And welcome once again, Ms. Sylvia Lemus. Thank you for taking the time once again to come over and talk to us about COVID and give us the most updated information about this. What can you tell us about the rate of infections? And I think there's that piece to celebrate that we went from, that we're now in the red zone, I guess.
Mhm.
What can you tell us?
Yes, Rafael, we have confirmed 28,820 confirmed cases here in Sonoma County, and that's up 36 cases in the last 24 hours. So the numbers are coming down, but there's still a lot of widespread COVID in the community. So we still have to be careful. Unfortunately, we have lost a total of 308 people to COVID. That's the total number that we have of deaths to COVID, 308 people. But we continue to do testing. We've completed 575,443 tests in Sonoma County. That's an addition of 1,679 tests in the last 24 hours. And then we're also continuing with vaccines. We have now completed a total of 217,818 doses of vaccines given here in Sonoma County. And I'll talk a little bit more about the vaccines later. But as far as the metrics, we have moved, like we said last week, from the purple into the red tier. And now we're in the red tier. So the next goal is to get to the orange tier, which will open up the economy and a lot of operations a little more here in Sonoma County. But according to the red tier is according to the California Blueprint for a Safer Economy, and the metrics that are comprised of that are the rate of new daily cases per 100,000 population is now at 6.8. So it needs to be less than 4 cases per 100,000 for us to be able to move into the next tier. Our test positivity rate is 2.5%. It needs to be less than 2% for us to be able to move into the next tier. And our our equity metric test positivity rate is 3.9%. And it needs to be less than 2% for us to be able to move into the next tier. So we are in the red tier, but we still have substantial or widespread, substantial risk of COVID here in our community. So we still have to continue doing everything, wearing our masks, maintaining our distance, following all the protocols, safety measures against COVID. Like I said, we have to, and one of the other things that's really important to do is testing. Because testing is really important to identify cases because a lot of people are asymptomatic, they have no symptoms, and what's happening is people have COVID, they don't know it, and then they're spreading it to their families and community members. So it's really important to get tested. So what we're recommending is that people get tested either once or twice a month. Twice a month, especially if you have exposure to the public through your job or different reasons. But if not, then maybe once a month, and that helps us to identify cases, and it also kind of helps to keep our metrics in a better place as well. So here in Sonoma County, Rafa, we have so many different options, at least 26 or more options of testing throughout the whole county. So we ask you to contact your clinics, and if not, go on our website on socoemergency.org. There's a button there that says get tested, and there's information on there on all the different possibilities of testing. You can make an appointment online, and you can even call the testing hotline, which is 565-4667, and they can help you to direct you to how you can get an appointment. Rafa, the testing it's free. It's available to anyone. It doesn't matter immigration status. It's confidential, and you may be asked to be shown an ID, but it's not required to get a test. And the results come back really fast, within 24 to 48 hours. And the testing has changed. It's really easy now. In the past, the testing was a little bit more harder because they used to use the cotton swab that went really deep into your nose, and now it just goes around the inner part of the nose really easily. It's really simple. I mean, I did it last week, and it was just so simple. I couldn't believe how simple it was. So we really recommend people to help our community by getting a test on a regular basis. It's really important.
And again, just reminding the community, and we said this in Spanish as well, I said this in Spanish as well, that deciding whether we are on purple or red and why we are in red and why we start opening, it really has not necessarily to do with safety, necessarily that we are all safe and we just need to take the masks off, but it's an economic decision. It's about making sure that businesses don't go out of business, that businesses stay afloat. And while I understand the need for business, I think it's, as you clearly said, it's important that we keep taking care of ourselves. And it is important to understand that if you choose to eat indoors, right, because they don't check your temperature, because they don't ask you a bunch of questions before you go and eat indoors, my personal suggestion would be that if you are going to get food from a restaurant, pick it up and take it home and eat it. I've seen situations where people are now walking into restaurants without masks, and the employees don't say absolutely anything. technically the protocol is my understanding is you walk in with your mask, you sit down, you make your order. Then it's not until your food comes to you that you remove your masks. After you're done eating, you put your mask on, especially if you're going to stay there to chit chat with a friend. And so it's essential that people understand this protocol. And so the safest thing that you could do is pick up your food, take it home, and eat it in a safe space, or eat outside the restaurant in order to still support the restaurant if that's what you choose to do, but doing it in a safe way. And so that brings us to the vaccine. What's going on with the vaccine? We now have Johnson and Johnson as one of the vaccines that is available, which only requires one shot. And so what can you tell us about it?
Yes, Rafael, so we have now surpassed 200,000 vaccines. I mentioned that as of this week, we now have, I think, a total of 212,000 doses that we've administered. So that's people that have been partially vaccinated are 72,245 that received at least one dose. And people fully vaccinated that already have both doses or the Johnson & Johnson are 68,643. So that translates to 17%. That means 17% of our population that's eligible to get the vaccine is now fully vaccinated, and 35% is partially vaccinated. The only issue that we're having, that we continue to have, is that we're not receiving enough doses of the vaccine. So you probably have seen about some places only doing second doses. They're trying to catch up with the people that have been partially vaccinated, and because there's not enough vaccine. For example, the county this week only received 8,180 doses, and that does not include Johnson & Johnson, which we won't be getting maybe towards the end of the month. I'm not sure, but we're only getting right now Pfizer and Moderna. But at the same time, I can also explain how it works. Some of the pharmacies like Safeway and CVS, Walgreens, some of the pharmacies, they're getting their shipments directly from federal government. And some of the hospitals locally are getting their shipments of vaccine directly from the state directly. But the county, the allotment that we get, that 8,180 that we get this week, we're distributing that to all the clinics, the federal qualified health clinics here, and some of the county sites that we're vaccinating. So that's why we're having such a hard time, especially applying equity in the vaccination. So we are doing the best we can. We're hoping and expecting that it's going to increase, especially soon it's going to be transitioning and a slow transition over to Blue Shield, who's a third-party administrator. So we're expecting to receive more doses so we can catch up with a lot of the people that are now eligible. So talking about eligibility with the vaccine, we are still in phase 1. We're in tier 1B, which as of this last week expanded to include people with comorbidities, like medical situations. And so now people between ages of 65 and older are eligible, plus other categories. And now people with comorbidities from ages 16 to 64 are also eligible. And that includes items such as cancer, chronic kidney disease, Down syndrome, pregnancy, heart condition, severe obesity, type 2 diabetes, and a list of other conditions. So that group of people are also now eligible. So it's really hard right now to find vaccine doses in the county until they increase the amount of doses that we're getting. So we just ask for patience from people during this process, and we hope that we're able to catch up soon as we start getting more vaccine doses.
Yeah, so that's one of the items, again, for individuals to understand. If you're a teacher, if you work in a school, because they're trying to reopen these spaces, some of those people individuals are now getting some of the vaccines that maybe in the past would have gone to somebody else, but everybody that I know wants to, again, open the schools because, they don't want their children at home. So sacrifices will have to be made, and it is important that people understand that this is one of those sacrifices. So it's good to know that, the county is working. Again, reach out to your service providers for health, whether it is Kaiser, whether it is Sutter, whatever it is that you have. And then again, it's about taking care of yourself. Even after you have the vaccine, wear your mask, get tested, keep your distance. Again, don't hang out with people who definitely haven't gotten the vaccine, because you don't want to get the virus and then give it to a family member that maybe is not protected.
Yes, because you're vaccinated, it is possible to still get COVID. And what'll happen is you just may not have symptoms and you may not even know it. So you could be passing on to other people. The good thing about the vaccine, Rafael, is that the studies have found that people that have taken the vaccine, there's been no bad symptoms, like strong symptoms, severe symptoms or effects, no severe effects. There's been no hospitalizations and no deaths. So, and that's the bottom line, is we want to
Mhm.
protect people, protect the community. So we really encourage vaccination and for people that when it's your time, when it's available, please get vaccinated. It's so important for our community.
Definitely. So with that, again, unless there's anything else, again, I want to be respectful of your time. Is there any final comment that you would like to make?
No, just continue to protect yourself and your community. And remember that SoCoEmergency.org, we have a lot of information in there about the vaccines, about testing and setting up appointments. So please, find your resources and just kind of check it regularly and keep updated and share factual information with other people. Really important to kind of let people know that when they say something to kind of correct them or point them to a place where they can get correct information.
Definitely. And with that, I want to remind our community members that my colleagues from different organizations, MECHA, the Hispanic Chamber of Commerce, MECHA de Montgomery, and several other individuals will be passing out masks from 11 a.m. until 2 p.m. at Del Mercadito at 777 Sebastopol Road this Sunday again. So we distributed over 2,500 last time. We're going to bring 3,500. So if you were one of the individuals who showed up and we had just run out of masks, please come back. We are more than happy to provide you with those tools to be able to take care of yourself. And with that, I want to thank you, Ms. Sylvia Lemus, for taking the time and being with us
Thank you for
today.
inviting me. Thank
Look
you.
forward to our next conversation. Take care.
Thank you, Rafael. Bye.